Hello everyone, welcome to yet another episode of the USTM Podcast series where we bring you the latest insights from the healthcare sector. I'm your host Taslima and today we are going to have a very informative session on World ORS Day with our esteemed guest Dr. Rashna Dass Hazarika, Professor of Pediatrics and Medical Superintendent, PS Sangma International Medical College and Hospital, Meghalaya. Welcome to the show, ma'am.
Thank you.
So let's dive right in. As we all are aware that World ORS Day is celebrated on the 29th of July every year. So we would like ma'am to enlighten our viewers with why exactly is this day celebrated.
Thank you, Taslima, for inviting me here today. We are discussing on a very important topic, that is ORS, because of the ORS Day celebration which falls on 29th of July, and we also have a full week celebration preceding that. Diarrhea is one of the most common causes of child death under 5 years of age. So in India, the current statistics tell us that it is the number 2 cause of death of children below 5 years, in spite of so much development. And the main reason for this are mainly two. One is we still are having very unhygienic practices in our society. Like, for example, people do not wash hands properly, and especially in summers they will have no exposure to clean drinking water. And currently with the floods, we know there is a mixing of all kinds of water. So the water which is available to the population for use is not at all safe. People do not take care of boiling the water or filtering them. And then in the especially in the towns and cities, people are going for intake of junk food like pizzas, burgers, and also now we know we have Swiggies from where they order food. So these are actually not kept or prepared in a hygienic manner. The third important thing is that people are still using very unclean things like bottles, especially in the small babies. So bottles, when they use, what happens is that first is the cleaning, they may not do it properly. Second is when the baby holds it or the child holds it, it may touch here and there, and they will still again put the dirty nipple inside the mouth. So these are some of the reasons why diarrhea is still prevalent in our country. And because when the child has diarrhea, there's a lot of loss of fluid, and along with the fluid there is a lot of loss of salt. So these children become very vulnerable to get very sick, and many a times they progress to the point where they can die also.
Absolutely true, ma'am. I'm sure that was very helpful to our viewers. So, ma'am, could you please tell our viewers what are the ways to treat a child who gets diarrhea?
So I think this is a very important part of the discussion, how to treat the children. So this year's theme of the government of India is Stop Diarrhea. डायरिया के रोकथाम, सफाई और ORS से रखे अपना ध्यान. This is what has been given as a theme for this year. So in this theme you will understand that it talks of all the treatment possibilities. Yes. So which means first of all you try to prevent. Do not allow your child or yourself to get diarrhea. Second is, if you have diarrhea, then safai means cleanliness. So we've already talked of that. So how do you keep clean? You have to wash hands, you have to take potable clean drinking water, avoid eating outside, especially in this season. And the third part is, most important, is ORS. I think by now everybody, even in the villages in India, know what is ORS. Yes. That is oral rehydration solution. Now this is a special solution. It is not like normal water. This solution is made by taking, say, a liter of water, potable drinking water, with a packet of the ORS salt. Salt means it has sodium, potassium, glucose in a definite combination. So whenever we talk of ORS, one of the most important thing for any parent or any patient to remember is that they have to take the WHO approved ORS. Yes. Now why I am insisting on this is because there are many ORS like packets available in the market. Yes. but they are not all WHO. So, and the proportion of salt, sugar is not correct in those solutions. So, it is only WHO approved or WHO ORS solution that we have to take.
Okay.
So, this is one important message I want to give, because if you take a solution which is not WHO approved, you may land up worsening the diarrhea,
Okay.
or in fact the patient may have more salt in the blood, and that may cause the patient to have unconsciousness or seizures in some cases. So, one is, the most important is ORS, and that is WHO approved. So, how do you make it? It comes in 2 packets. One is a small packet, the other is a large packet. So, the large packet is mixed in the 1 liter of clean water, and that can be used over 24 hours. The small packet is made in 200 ml of clean water. So, when they are mixing also, they have to mix the entire packet in the amount of water which is written on the packet.
Okay.
It's not that you take 1 spoon and mix it with 1 glass, it's not like that. So, you prepare the whole solution and then you use it over time.
Okay.
So, this is the most important message which people should know. Many people ask us about homemade ORS, but we are not encouraging homemade ORS these days, because invariably parents make mistake in adding the salt and sugar. The other fluids that can be used are like coconut water, which is easily available with us, and nimbu pani, which every household can make.
Yes.
But the best is the WHO ORS. The other things which we generally advise parents are the food, because many times they stop the food, because as soon as you give food, they say the
Yes.
child will pass stool. But that is not correct, because if you don't give food, the child is going to go very weak. So, for food, we ask them to take bananas, ripe bananas. In this part of the country, everybody likes bananas and they give bananas to the children. Banana is important because it not only absorbs the water from the stool, it also has a lot of potassium, which is important salt during diarrhea. The second thing is the green banana. They can boil the green banana and give it as a meal.
Okay.
Third is they can use the homemade khichdi. And fourth is the dahi or the curd, because curd has lot of good bacteria, which is known as also a probiotic. So, if you give curds, then it is going to work very well in diarrhea. We also advise, along with ORS, the use of zinc solution, because zinc solutions, they help, the zinc component helps to recover the gut, because whenever you have diarrhea, there are a lot of cells which are washed off. So, those cells will be regenerated by the use of zinc. So, that advice is given by the doctors, so they can take advice of their pediatrician or the family doctor, and this can be added in the diet.
Okay.
And so, ORS, frequent feeding or the right kind of food, and zinc.
That was very informative. So, now since ma'am you have mentioned diarrhea, could you please tell our viewers what are the ways to prevent it?
Okay, so you are asking me about how to prevent diarrhea. So, as I have already told you the reasons that people have diarrhea, so from that you can understand that the first thing is you have to have access to clean drinking water. So, which means that you may have filter water at home, or if you have other sources of water, especially before drinking, then you must boil it. So, boiling means from the point where the water starts boiling, we have to boil for at least 10 minutes. Then only the water will be clean enough for us to drink. Third is, whenever you are buying food, you have to ensure that it is clean and it is washed properly and then only fed to the child. And since people now have a habit of ordering food from apps like using Swiggy and other apps, so we must discourage this. So parents should not order food online, because many a times we don't know whether it's fresh or not. It is best to prepare fresh food and feed the child, and stop the use of the bottle, especially in the smaller kids, because this is a very, very unhygienic practice.
Good to know all that information from ma'am. And lastly, we would like to know, how do you how are you planning to celebrate World ORS Day in PIMCH?
Thank you, Taslima. I think that is a Nice question. We at PIMCH are planning to have multiple activities on the occasion of the ORS week as well as the ORS day. So we have activities in the community where we are visiting our nearby PHC and CHCs, where we will hold a health camp along with an awareness camp of how to prevent diarrhea, how to make ORS. We will do demonstration. So we'll be sending teams for those activities. We will also try to do some activity in the city of Guwahati through our ARDF Foundation to bring again the same kind of awareness among our city dwellers. Secondly, we are holding some very interesting activities for our PIMCH staff. So we have planned out a quiz on ORS for them, plus a competition of making posters.
Nice.
So I think this is going to be a very interesting way we are going to increase the awareness among not only the community but also among our own staff, which includes the nurses, technicians and other paramedical staff. We're also going to have an ORS corner or an ORT corner in our OPD on those in that particular week, where everybody who comes to the OPD will be shown how to at least make the proper ORS, and also we will be putting up these posters made by the staff during the competition. So we'll put it up so that they have some communication, education material which is they can read passively, and they will see the demonstration of the ORS making live on those days.
Okay. Thank you, ma'am. That was very informative. I'm sure it will be very helpful to our viewers. Pleasure having you on the show. To our listeners, if you or your loved ones are in need of medical care, PA Sangma International Medical College and Hospital is a place where you can expect high quality treatment with a compassionate touch. Thank you for tuning in. Until next time, stay healthy and take care. For more details, please log in our official website.
you.